While the world is at risk of yet another pandemic, the United Nations recently announced that at least 1 billion people around 43 countries are at risk of cholera. The United Nations has termed it as a pandemic killing the poor. If the action is not ramped up immediately, the United Nations has warned of a cholera catastrophe, claiming lack of resources. The United Nations is seeking about $640 million to fight against the contagious disease, branding the outlook bleak. The United Nations has warned of the situation getting even more dire. Now, according to the United Nations Health Agency's incident manager for the global cholera response, Henry Gray, WHO has estimated that about 1 billion people across 43 countries are at risk of contracting cholera. 24 countries have already reported cholera outbreaks so far this year. Even the countries that are not usually affected are being affected now, with the fatality rates far exceeding the average 1 in 100. Cholera is a bacterial disease that is generally transmitted through contaminated food or water. Along with poverty, conflict and climate change, a major factor contributing to the rising cases is population displacement. This deprives the people of safer food and water sources as well as medical support. Main symptoms of cholera include diarrhea and vomiting. The infectious disease is especially dangerous for young children. Now, according to Jerome Pafman Zamruni, the head of UNICEF's Public Health Emergency Unit, the rampant increase in cases is a wake-up call, and that the human-induced pandemic is killing the poor rampantly. If not acted now, it could get even worse. Although cholera is treatable with simple oral rehydration and antibiotics, for more severe cases, it is capable of killing within hours without timely access to treatment. Outbreaks can surely be prevented by ensuring proper access to clean water and better surveillance. Investing in wastewater infrastructure in the long term is the most prominent solution to the problem.